On this Friday night, closed, cancelled, and confined. The Prime Minister's new reality.
I am in isolation, as are my children, and my wife is in quarantine.
His promise.
We will help Canadians financially.
As the travel plans of thousands of Canadians go up in the air.
Postpone or cancel all non-essential travel outside of Canada.
And in the U.S.
I am officially declaring a national emergency. Two very big words.
Plus, some hope.
Global National with Dawna Friesen.
Upon my doctor's recommendation, I will remain in self-isolation for 14 days. I want to be clear, I have no symptoms, and I'm feeling good. And technology allows me to work from home. Of course, it's an inconvenience and somewhat frustrating. We are all social beings, after all. But we have to do this, because we have to protect our neighbours and our friends, especially our more vulnerable seniors and people with pre-existing conditions.
That is Canada's Prime Minister, confined to his own home by the coronavirus. These are extraordinary times. Good evening and thanks for joining us. The Prime Minister is not sick, does not have COVID-19, but his wife Sophie Grégoire Trudeau does, and so he's working from home. This pandemic is having a profound impact on all of us, and events are moving fast. Here's where we're at right now. Canadians are advised to avoid all non-essential travel outside the country. Parliament has suspended sitting for at least 5 weeks. The Bank of Canada cut interest rates today to 0.75%. National museums across the country are closing. Europe has been declared the epicenter of the pandemic. And the American president has declared a national emergency. The number of cases in Canada keeps rising. There are now almost 200 confirmed cases of COVID-19. 7 provinces now have cases. Ontario is reporting the biggest jump in new cases, 19 in the past 24 hours. We have lots of ground to cover tonight. Let's start with David Akin in Ottawa and the message from the Prime Minister. David.
That's right, Dawna. It was almost as if to underline the fact that being at home in self-isolation does not mean being inactive. Justin Trudeau, his cabinet, the Bank of Canada, made a blizzard of announcements Friday.
I know that you're worried. You're worried about your health, about your family's health, about your job, your savings, about paying rent, about the kids not being in school. I know that you're concerned about uncertainty in the global economy.
So the government is tackling all those concerns. First, Trudeau added his weight to what other provinces have said and what Canada's top doctor said. Do not travel outside Canada. There are also new travel protocols that will affect all overseas flights to Canada and all cruise ships that want to dock in Canada.
Every order of government is working to stop the spread of the virus. Businesses and citizens are taking precautions. We have outstanding public health authorities who are doing an outstanding job. We will get through this.
Then the Bank of Canada jumped in with an emergency interest rate cut of 50 basis points, bringing the overnight rate down to 0.75%. That followed a 50 basis point rate cut just 2 weeks ago. Finance Minister Bill Morneau pumped $10 billion into new lending programs for business and tweaked the rules that banks have to abide by. That frees up another $300 billion in lending capacity.
As your Minister of Finance, we are going to do whatever it takes to protect Canadians and keep our economy strong.
In the meantime, Trudeau and his cabinet are preparing a financial stimulus package that could be worth between $20 and $40 billion. Trudeau discussed the plan with the premiers on a conference call on Friday afternoon and expects to announce details next week.
No one should have to worry about paying rent, buying groceries, or additional childcare because of COVID-19. We will help Canadians financially.
And finally, Dawna, in a rare show of unity, all political parties agreed to suspend Parliament temporarily. MPs and senators, will not be back here in the capital until April the 20th.
All right, David, are Trudeau and his kids sharing the house with Sophie, or is she shut herself away in a separate part of the house in order to reduce passing the virus on to him. And is he being tested?
We talked to Trudeau's aides about Sophie's status, and they were reluctant to tell us much about it. But Trudeau himself did say she's in quarantine while he and the kids are in isolation. The difference there, apparently, the Prime Minister and his kids are interacting, but Sophie is not while she's in quarantine. Now, as for Trudeau being tested,
in terms of advice I've gotten from medical professionals, it was explained to me that as long as I do not show any symptoms at all, there is no value in having me tested.
And experts say that actually saves scarce health resources. No need to take the test until you're symptomatic.
And he is in self-isolation in the meantime. David Akin in Ottawa, thanks. The Prime Minister's wife was in London last week. Sophie spoke at an event for International Women's Day at Canada House. And today, Canada's High Commissioner to the UK, Janice Charette, said she is also self-isolating at home as a precaution, and everyone else who attended the event at Canada House is being contacted. This pandemic is altering all of our lives in ways we never imagined a few weeks ago. That includes the tens of thousands of families who had trips planned for March break. Now we're told all travel outside Canada is a risk and should be avoided. Even the Canadian military has banned all foreign travel and ordered non-essential personnel to stay home. Jeff Semple looks at what Canadians need to know about travel during this pandemic. Jeff?
Well, Dawna, Pearson International is Canada's busiest airport, and this is typically its second busiest day of the year, ahead of March break. This time last year saw more than 140,000 passengers pass through here. But take a look. The picture today is much different.
No lineups at check-in or security for passengers at Pearson. The airport hired extra staff for the spring break rush, but in hindsight, probably didn't need to.
Given the situation with regard to COVID-19, we are expecting and seeing an impact.
Susan Rasmussen's family had tickets to fly to the southern U.S., but decided to stay put.
We didn't want to catch the virus, plus we did not want to bring it back with us.
This Edmonton couple learned about the government's travel advisory from Global News at the airport and promptly canceled their trip.
Things are changing so quickly right now.
But others, like this family heading to Cuba, are packing supplies and taking their chances.
But it is scary. We were much enthusiastic and much excited, and then now we're traveling with a little bit of scare.
But those who do decide to travel abroad may find themselves with an uncomfortable homecoming. Cruise ships with more than 500 passengers will no longer be allowed to dock in Canada. The federal government is asking anyone who travels abroad to report symptoms such as a cough or fever. And those who return from Italy, Iran, or Hubei, China are being told to self-isolate for 14 days.
What we have to remember is that viruses don't know borders.
Some passengers told Global News that their employers had warned them if they travel, they won't be paid for 2 weeks.
Probably within an employer's right to say, I want to take a precaution and not allow these people to, and not have these people work for a period of time. But if you make it an unpaid layoff, that's going to be a problem.
And passengers arriving here to Canada can also expect more disruption in the weeks ahead. The government plans to restrict the number of airports in Canada that can receive international passengers and introduce new screening measures for those arriving from abroad. Dawna?
Jeff Semple in Toronto, thanks. Now to the United States. President Trump has declared a national emergency and offered individual states billions of dollars in support. As he spoke, stock markets began to surge after days of sharp declines. And there's a report a second person who was at Mar-a-Lago with President Trump last weekend has now tested positive for the coronavirus. Abigail Bimman reports on how life is changing in the U.S.
The action I am taking will open up access to up to $50 billion.
President Donald Trump declaring a national emergency in an effort to contain the virus. But as he promised more tests, he downplayed the gravity of the need.
5 million within a month. I doubt we'll need anywhere near that. We don't want people to take a test if we feel that they shouldn't be doing it.
Trump shook hands and touched people at the announcement. He promised more drive-through testing sites. Today, New York State opened its first in New Rochelle, the hard-hit area under containment.
There are 6 lanes that are operating. You drive in your car, and the medical staff comes to you. does the test, takes the swabs.
Testing is still not where it should be in the U.S., admits one of the country's top doctors.
What we really need is to get the test available in venues that people could easily access. It is very likely we will have that within the next week or so.
We will let people in groups. Please be patient.
Long lines at this New York grocery store with empty shelves, a regular sight. One example of how daily life in America is changing.
We're trying to stay calm.
Several states are shutting down all schools.
I don't have the option just to take time off, so here they are.
Meanwhile, lawmakers have been debating a bill to provide aid, including expanding paid sick days.
The three most important parts of this bill are testing, testing, testing. This legislation facilitates free coronavirus testing for everyone who needs a test.
But its future remains uncertain, with the president saying what the House Democrats proposed wasn't enough. Abigail Bimman, Global News, Washington.
Experts are looking at Europe to predict what's coming here in a matter of weeks, and it's not good. Today, the WHO declared Europe is now the epicenter of this pandemic. Italy, which had its first outbreak on February 23rd, is now overwhelmed with more than 15,000 cases and over 1,000 people have died. That all happened in just 20 days. Outbreaks in Spain, Germany, and France are also growing exponentially. Just 1 week ago, those countries were each reporting a few hundred cases. Now there are more than 4,300 in Spain, 3,100 cases in Germany, and more than 2,800 in France. Doctors in Ireland are warning that country is 14 days behind Italy. The worry is that if the spread isn't slowed down through things like shutting down travel and public events, healthcare systems across Europe will be overwhelmed. Crystal Gamansing reports.
A state of emergency takes effect Saturday in Spain after a surge of infections. In Europe, it is the second to Italy for COVID-19 cases. Spanish officials warn the infection rate could more than double to 10,000 by next week. The Czech Republic also declaring a state of emergency. It is closing its borders to travelers crossing from Germany and Austria. Austria is following Italy, closing all shops except grocery stores, pharmacies, and banks beginning Monday. Germany, meanwhile, is reassuring people with an economic pledge, €500 billion to support Europe's largest economy. In France, public gatherings are limited to 100 people. The Louvre, Eiffel Tower, and several other historic attractions are closed. The Queen cancelled 2 upcoming public appearances. Buckingham Palace says other events will be reviewed on an ongoing basis. Crystal Gamansing, Global News, London.
Empty shelves, overflowing shopping carts coming up. The pointless panic buying going on across Canada. You may have witnessed scenes like this yourself. There was advice from public health officials to slowly stockpile some essentials in case you need to self-isolate. Some are taking that way too far. There's been panic buying. In some cases, people are buying vast amounts and selling it at a profit. Others are hoarding just in case.
This is crazy. This is the craziest I've seen.
Yes, I was worried I couldn't find supplies.
What'd you buy? Toilet paper, hand sanitizer, and almond flour.
Well, here's the thing. The Retail Council of Canada, which represents all major grocery chains in Canada, is urging consumers not to panic buy because Canada has one of the best supply chains in the world. What are you going to do with all that toilet paper anyway? As restrictions are put in place to slow the spread of COVID-19, there is the question about whether or not to close schools in this country. Italy, Spain, even France have shut schools entirely for at least 2 weeks. Some provinces in Canada have followed suit, and universities are moving courses online. As Ross Lord reports, the right approach is a lesson in itself.
Shutting down schools is an obvious option for limiting the spread of COVID-19. First, Ontario decided to keep publicly funded schools closed for an extra 2 weeks after March break.
I want Ontario families to know we are unwavering in our focus in keeping students and staff safe.
Followed by neighboring Quebec, which has already had March break.
De fermer toutes les écoles, cégep, universités et services de garde.
All schools and daycares closed for 2 weeks. Manitoba then announced it was following suit. Other provinces are taking a softer approach, urging anyone who travels outside Canada to stay at home for 14 days after they return, including students and their families, but stopping short of keeping everyone away from schools.
The level of the disease differs between province and province, and the strength of your public health measures therefore needs to be will be differ.
We need to understand more about the role of young people in transmission of this disease, and we know that sometimes that the impacts of closing schools, particularly abruptly, can cause a lot of societal disruption and economic impact.
Medical experts say keeping the doors closed throughout Canada is inevitable.
I think it's definitely the next thing to happen in the provinces that have not done it, depending on what happens over the next few days of the outbreak.
For parents, there's no perfect solution.
So it's better to be closed, but this is my opinion because I'm not working.
In provinces forcing closures, working parents wonder how they'll supervise their children.
I don't know what we're going to do, but we'll have to figure it out.
More universities by the day are closing or shifting courses to online only. But COVID-19 is revealing how much everyone wants to do the right thing and how hard it is to figure out what that is. Ross Lower, Global News, Halifax.
Overcrowded and remote communities ahead the risks some Indigenous Canadians face. Too many Indigenous communities in Canada have poor housing and limited access to medical services, and that puts them at higher risk as this virus spreads. Heather Urix-West explains what's being done to prepare remote communities for what's coming.
Members of Southern Alberta's Blackfoot Confederacy are planning their next steps, looking into how the elected leaders of the Piikani, Siksika, and Kainai First Nation can help their people prepare for COVID-19.
We don't want our youth infected. We don't want our elders infected. We're looking at everybody in the community.
On the Siksika Nation east of Calgary, visits to the Elders Lodge have been restricted. Several large events have been cancelled. But the housing on this reserve is a major concern as well.
Should somebody possibly get diagnosed or the test come out positive and they are in an overcrowded home of, let's say, 10, 12 people, and the treatment is to isolate yourself.
We have 54% overcrowding in relation to housing, and with the increased conversation about self-isolation, if there are COVID-19 outbreaks in some communities, that just won't be an option for many Inuit.
In many remote Indigenous communities, accessing local health services is not an option either.
If there's a situation that does come into the immediate community, we don't have no nursing centers, we have no health centers, and we have no health staff. What happens when it hits our villages?
The federal government says it's working on solutions. They've promised financial support, and they're working to procure specialized isolation tents for screening and testing for communities without adequate infrastructure. Temporary shelters are also being considered. Help Indigenous leaders say will be critical as COVID-19 spreads. Heather Urix-West, Global News, Calgary.
Next, where to find optimism during this pandemic.
You're watching Global National.
We left the good news for last, and yes, there is some good news about this virus. The vast majority of people who get COVID-19 have mild symptoms and recover from it. In fact, roughly half of the 137,000 people who have caught this virus worldwide, that includes tens of thousands of people in China where it started, have recovered. Eric Sorensen shares some optimistic news during a dark time.
It is a look of modern desolation. Empty arenas, political chambers, airports. Images of society in retreat. An empty feeling has swept the world more quickly than COVID-19. The stock markets, the instant pulse of the economy. From big gains to bigger losses symbolizes the swings between hope and despair. It's easy to find reason for pessimism. 3,000 deaths in China alone from an especially efficient virus. And Italy demonstrates that a modern nation with impressive health care could not keep up. And the numbers are climbing daily. Our closest neighbor may well have responded way later than it should have.
Anybody that wants a test can get a test.
And in this country, lineups for basic food is a shocking sight. But consider reasons for optimism, even at a time like this. In China, the first wave of this pandemic appears to be receding. Chinese mobilization to build hospitals was remarkable. South Korea, where cases spiked sharply, aggressive measures like 10,000 tests per day has limited the number of deaths. In Africa, an impoverished continent recently saw its first cases, but a warmer climate may be more resistant to this virus, and Africans have exceptional experience dealing with deadly diseases. Children appear to have greater immunity. That is wonderful news. And for the elderly and vulnerable, this nation's sense of calm and concern has been a hallmark of Canada's response. And while social distancing will buy us time, Toronto's Sunnybrook Research Institute and 2 universities have isolated the COVID-19 virus, the first step towards better treatment and a vaccine. In the meantime, there is human spirit. In hard-hit Italy, serving coffee with imagination. And on a deserted street, a serenade from one apartment to the neighbors. There is reason to be pessimistic and optimistic, but we can bridge the two by being realistic. Toronto.
Love that. And that is Global National for this Friday. I'm Dawna Friesen. Tonight's Your Canada is the CN Tower that defines Toronto's skyline. The landmark shut its doors to the public until next month, but will still be lit up every night. And we'll be here each night as well. Robin Gill is at the anchor desk this weekend, and I'll see you again soon. Thanks for watching and have a lovely weekend. Bye-bye.